Well, I'd like to very much thank Alden and Michelle for agreeing to give this session today. It begins, as you've just heard, a 2 research in progress session mini module on cognition. And you just couldn't have 2 better experts to give their thoughts on this topic. So thank you so much. And I guess I'll turn it over to Alden.
Yeah, so thanks, Karen, thanks, Brian, and everybody. So yeah, Michelle and I wanted to talk today about how do we measure cognition and what is it that we're trying to assess. And, you know, we would really like this to be a conversation. So, you know, we're monitoring the chat, and feel free to unmute yourself if you have a question. Scream at us, interrupt us. It's really hard to do these things remotely, but imagine that we're just sitting in a nice, you know, living room fireplace having a chat about this. So, and Michelle, break in whenever you feel like it. Your slides are here. So in terms of outline, you know, we wanted to give a brief introduction and talk about cognitive domains. And so if you guys have many of you are taking or have taken our Epi of Aging course, where I give a lecture on cognitive aging and I talk about cognitive domains. Michelle has her 4th term brain and behavior course that honestly I cribbed from my lecture, because, you know, that's where I learned things. But this is not a settled research area. So we're going to talk about that. Then we're going to talk about memory in different forms of memory. We're going to talk about executive functioning, and Michelle's going to talk to us about some nuances there and some computer-based tools. And and then carrying on from something that came up in our last EBA when Karen talked about methodological issues. We wanted to address a big elephant, which is, what does time mean to us? And so we're going to talk about some aspects of time that are uniquely important in cognitive functioning and in cognitive aging research. So yeah, so in terms of how do we measure cognitive functioning, that really the answer is, as always in epidemiology, it depends. It depends on what you want to measure. So, you know, what is your scientific question? Are you trying to assess like longitudinal change in a particular process, like a dementing process? Or do you want to track the well-being of a general community living population over time? You know, what is your scientific goal? As one sort of trope example, and I think this is kind of a trope because I'm not so sure that things are this simple. In cognitive aging, we often typically think about measuring memory if we want to get at AD pathological processes and understanding dementia, whereas we talk about measuring executive functions if we want. I didn't finish that bullet, sorry. We talk about measuring executive functioning if we want to get at sort of vascular processes, or if we want to relate something with physical functions or you know, physical activity. And I'm not so sure it's that simple. I think there's a lot we still have yet to learn. To sort of hone you in on existing constructs of cognitive domains within public health, there is a set of cognitive domains that we learn about in public health, and this really comes from a neuropsychological tradition. And you know, if you look at the last bullet here, I'm talking about things like memory and attention, executive functioning, processing speed, and language, and visual, spatial, or perceptual ability. You can have several different mnemonic devices to help you remember those things. An important thing to keep in mind is that the evidence of organization and structure of the brain comes from that drives the neuropsychological tradition and that drives these domains really ultimately comes from studying head injury cases, starting in the early 1900s and really through the 1950s and 60s and up until today. This evidence does not come from exploring empirical correlations among putative tests of cognitive domains. There exists a different tradition that is more focused on administering large, lengthy batteries to people and trying to understand the structure of human cognitive abilities and the way that humans think from a more detailed perspective. And this is education and psychology. So if you can imagine for a moment, I'm guessing that for those of you who were psychology majors in undergrad, you probably remember volunteering as a freshman or sophomore in some professor's study. And you would go after hours, after the lecture, to their lab, and you would take a bunch of cognitive tests, and you had no idea what you were doing. But at the end of the day, they gave you $10 that you then went to McDonald's with, because we're poor undergrads. But yeah, so imagine much more detailed, richer data about cognitive functioning. So the issue is that neuropsychological domains like memory and attention don't actually fit the data as well as do models that come from this what I'm calling an education or a psychology tradition. You might call it a neurological tradition as well. On the next slide, I'm gonna talk about the periodic table of cognitive elements that I've been admiring for quite some time.
Before you introduce that, Alden, because that's awesome. I want to really reinforce what you just said, and I want to actually give you a sense of the functionality of the neuropsych. It was developed really for World War I and World War II placement of soldiers in high numbers. And so there was a real functional need. And we had hundreds of thousands of people who needed to be placed immediately and trained. How do you do that? That's where neuropsychology really came into its own with all the tests, and many of which you see today, and many of which Alden's going to summarize or show you. Many of them have a tradition from back in that time frame.
Yeah, exactly. I mean, I remember reading about some of the early psychometrists. They would actually go out and observe people doing tasks. Like, imagine if you want to design a better shovel, what better way to design a shovel is can you have than to go out onto a construction site and watch people dig. So that way you can figure out how you can make a properly curved shovel. Do you want a handle at the end, or do you want it straight? And how long do you want it, and so on and so forth. So yeah, during World War I, especially, and later, there was a real need to design instruments to, as Michelle said, place people. I want to note that the neuropsychological tradition is fairly young. It dates back to the World Wars, maybe 60, 70, 80 years. The psychological educational tradition, at least what I'm calling it, is a little older. It's a little older than 100 years old. And I'm dating it to Spearman's 1901 dissertation. So this is the periodic table of cognitive elements. How cool is this? It's based on this notion of understanding human cognitive abilities. So that's what cognition is. It's how are people thinking, right? And so it's this particular periodic table is the brainchild of this guy, the psychologist Kevin McGrew. And I just took his most recent, he releases blog posts on what he's doing, which is really cool. So this is his most recent attempt at a periodic table, but he is a student of the Cattell-Horn-Carroll model. So there's a whole cool history on that we don't have time for. But essentially, there are broad abilities in thick black squares, broad cognitive abilities, which subsume narrower, subsume narrower cognitive abilities. As an example, we have intelligence as a process, intelligence as knowledge, intelligence as a process, speed and fluency. Okay, so we in the neuropsych tradition, one of our domains was language or fluency. So maybe some things will fit there. Can anybody see where memory fits? Knowledge, possibly. Where's executive functioning here? I'll go on. So this GI, yeah, up here, GI, this, let me annotate again. This is learning and memory. This is the closest thing to what you and I think of as memory. And it's only 4 little blocks in this whole periodic table. It's really cool. This is derived based on studying empirical correlations, actually gathering out and gathering data on tests that mostly college students sit and take, because it's hard to get, you know, people, the working public and retired people to sit down for days on end and take things. So, you know, their measure of what they call learning efficiency includes things like associative memory. So associating, you know, 2 objects together, or 2 notions together, and then understanding meaningful memory, and then of course free recall memory. So this free recall memory is like the bread and butter of cognitive aging. We love administering our free recall tests, either paragraph recall tasks or list learning tasks, and we get a lot of variability out of that. And so we like those statistically as variables to use in our models, and they're pretty efficient to measure. So yeah, now that you've got all the tests, all the names on the slide, again, where's executive functioning? So the answer is, oh, was somebody gonna? So the answer is there's no space for executive functioning in the periodic, in this tradition's periodic table of cognitive elements. Executive functioning is really a domain that was born out of necessity. We want to understand not just human cognitive abilities and how people think and process things. We want to understand how people interact with their environment. So we think about executive functioning as things like planning and problem solving and things like that. So how do you problem solve? So if you're going to put 5 people into an army unit, you probably don't need each one of those 5 lieutenants or whatever that are in that army unit to be able, you don't need each one of them to be able to repair a broken antenna on a radio in the middle of the field, but you probably want at least one person to have that skill just in case you need to. So, you know, in the neuropsychological tradition, there was this need to describe people's ability to interact with their environment and to plan and to problem solve. And so, but you know, in any data set, I will guarantee you, if you were to look at the correlational structure among a bunch of memory tests, and then look at the correlational structure among a bunch of executive functioning tests, the executive functioning tests don't share that much overlap in correlations. So, you know, going back to how do we measure cognition, at least one thing is clear. If you take anything out of this next hour, one thing is clear. In order to capture complexity and nuance, we need more than a 10-minute assessment. So in this picture I'm showing is the MiniMental state examination, which is probably the most widely used and cited test in all of psychology. It's a 10-minute cognitive assessment. You can score people from 0 to 30, and you ask questions like, what's the current year? What season is it? What's the day, date, month, and so on and so forth. This is really designed to get at your mental status, and it's useful in clinical settings, not necessarily in community-based settings, but so if your goal is to assess cognitive status in the community, then this is your tool. This is what you want to do. But is that really your goal? What is it that you're trying to measure? So these are some cognitive tests by domain. And I won't go through each and every one of these. This is for another whole lecture that Michelle, I believe you give. But for example, if you look at memory, the memory domain, there's verbal memory, visuospatial memory. Different tests of verbal memory are can give you very different lessons about how a person is processing, how a person is thinking. And when you use a test in your analysis, or when you look at exposures and outcomes in an epidemiologic setting, don't just put the score because you have it into a model. Try to understand what it is and what the nuances are. For example, the AVLT, which stands for Auditory Verbal List Learning Test, is a list of 15 words that are repeated a bunch of times, and all of the words are semantically unrelated. So we're talking about ball, flag, tree, hat. And so in order to perform well on that, typically people are using some sort of a repetition strategy, or they're making up their own story to try to understand these words, such as like, I see a ball and a flag outside, and there's a tree outside, and I'm wearing a hat when I'm outside. Okay, so ball, flag, tree, hat. I got this. Okay, we're set. Whereas the CVLT, the California Verbal List Learning Tests, these words are semantically related. Like, think of a shopping list, or think of certain types of things like, knife, fork, spoon, bowling pin, baseball bat, basketballs, kitchen implements, and then sports equipment, stuff like that. The types of strategies you use to perform well on this type of test are very different than how you would do what you would use on the AVLT rather. In terms of different types of memory, there's, to be very simplistic, we can talk about working memory, which you can think of as short-term memory. Strictly speaking, in basic psychology, working memory operates in the span of a couple of seconds. It's really short-term memory. How do you process and encode information and get it into your long-term memory, into your long-term stores? And so working memory is actively held information for verbal and nonverbal tasks. Working memory is not quite what we think of as memory. It's more attention and attentional capacity. So, don't mistake working memory for, say, episodic memory or something like that. And there are some other types of memory. I'll highlight episodic memory down here because that's a very common type of memory task that we often measure. Generally speaking, episodic memory is knowledge of specific events experienced by an individual. So it entails locating an event in space and time. We believe we know that it relies on the hippocampal activity, and the hippocampus is this small horseshoe-like piece in your brain. We talk about verbal episodic memory, and that's what a wordless learning task is designed to measure. There are lots of other types of memory on this slide that are not detailed, such as I'll just highlight procedural memory, such as remembering how you brush your teeth or how you ride a bicycle. These are, and this is important because these types of that type of memory does not deteriorate with age. So procedural memory abilities they don't deteriorate with dementing processes. So a person with dementia still knows how to brush their teeth, and they'll still be able to ride a bicycle. And so on and so forth. Michelle, do you want to talk about executive functions?
Sure. Do you want me to share my screen, or do you want to go ahead and
sure. Yeah. You go share your screen.
Yeah, just in case it helps.
Yeah.
Let's see.
Or you could tell me when you want to advance. Oh,
yeah, sure. We may end up doing that. I should go back a little bit, and I'm not. Let's see if we can do this. Okay, so I'll switch, and executive function really follows memory, as Alden nicely articulated. There's so many different types of memory, and we tend to focus on the ones that are easiest to measure in clinical and community settings. And that's probably a matter of convenience as more than a matter of primary focus. Executive functions, as Alden pointed out, really working memory is a conjunction of memory and executive function in one capacity. As he mentioned, you're storing information and you manipulate it in some way. And so that's a perfect marriage, if you will, of memory and executive function. It makes the point that really domain-specific cognition, the best we can do is try to parse out components of cognition, but in our day-to-day lives, they work together. So the same brain is operating across all these systems. We just have the struggle at times to figure out which domains are perhaps aging more rapidly than others. As Alden pointed out, for procedural, it doesn't decline in the same way other types of memory do. We need to learn those things through tests, standardized tests. So that's our challenge and our opportunity. I'm not going to talk too much. I wanted sort of messages to be related to, one, that there's a long developmental window. When we think about a human being, it takes a lot of time to develop certain components of cognition. In particular, executive function has a very long gestational period relative to memory development. There are probably good reasons for that. Executive functions have neural substrates in the prefrontal cortex, and they don't just regulate attention and memory, they regulate emotion. And I noticed in Alden, in your elemental table, I saw one of the newer features he added was emotional intelligence, which is a really hot topic these days.
Which I'll note is a domain that's listed in DSM-5.
Yes, that's right.
Emotional intelligence or social cognition.
That's
and
right.
We don't really, I was just having a conversation last week with colleagues about this. We want to measure this because we want to make algorithms to mimic a DSM-5 algorithm, and we don't really know how to measure your emotional or social cognition.
We're lagging behind the innovations, and something that maybe in this conversation somebody will get, maybe there'll be an opportunity. Sometimes it takes just a small opportunity to insert a new test or a new way of thinking about tests. And among them is, as you said, Alden, really emotionally salient memories and emotional intelligence are really coming on the rise, in part because of imaging. In vivo imaging allows us to understand the role of emotion in a way we could not do before. The third component for executive function that probably is less well studied, but is certainly important here in the context of the EBA, is motor function. Linda Fried she chuckles at me when I say this, but we don't travel around without our brains. We're always taking our brains wherever we go. And so, studying motor function, I guess it should make sense that there may be some degree of regulation when you have to do complex things in daily life, as Alden said, like walking and talking. Their executive dysfunction is so prolific. It's measured in so many different ways. It should be no surprise that it's implicated in many mental disorders over the life course. And so I think, this just makes the point, following on what Alden said about memory, attention and executive function occur at potentially very many different levels. Memory is not one static ability. It's the encoding process, it's the storage process, and it's the retrieval process. And any one of those steps can go awry. And we need to sometimes understand which step has gone awry. So you need different tests as a function of that. So in terms of executive function, I think what's nice to share is when we think about, it's called the executive for a reason. It was defined that way with like sort of these abilities that are too great, too many and too numerous really to anchor down. That's the problem. When it becomes so ubiquitous, it's hard to sort of specify what executive function is, but these are some of the terms that have been applied to it. And broadly speaking, it has to do with modulating attention, organizing information, and determining what's important at any given moment. And it's really, see it right here. You're leading with your dorsolateral prefrontal cortex. And then a related executive we're now learning more and more about is emotional control. And that seat kind of goes just under your frontal bone. It's just under the dorsolateral. And you see it here in that schematic. And they work together in concert with one another. And here you're modulating an attention and a perception about threat and social behavior. Again, Alden cued that up when you're talking about, day-to-day life. So these project very directly. The limbic system and the amygdala are part of memory, and then the frontal cortex is part of that modulation. So when they work together, it's really important to keep in mind development. And I think increasingly you have opportunities to look at data sets of people who were formerly young or younger, such as Eric, for example, Richie's study. It's a really important opportunity to think about what happened in midlife that may, or at least what we can capture prospectively from midlife studies that might tell us something about cognition that we might not otherwise have known. And so one of those opportunities is to think about how cognition is a developmental process, and memory develops at a different rate than does executive function. And this is a great schematic by Casey. She's up at Columbia. And I really like this schematic because it really makes the point that there's a period in which there's a lag between your prefrontal cortex, which is a very experience-based learning system, and the limbic regions that store memories needed to plan and problem solve. And when you're developing, it's possible that you hit a vulnerable period when your memory and your ability to do things has not caught up to your modulation and your good judgment. And that period is an age of risk. So these are things that kind of are helpful to know when we think about cognition. So these are just some examples of problems in these regions of the brain that might manifest. Like Alden mentioned, head injury is one opportunity to see some of these examples in both systems. But there are many, many other conditions where you'll see some of these problems arise. So I'm going to finish this section with a little description of what we do. How do we capture complex behaviors like this? So I'll give you an example of one that Alden and I know extremely well. I invited my new RA, Emily Richards, to join us as well today. And thank you for being here, Emily. She is carrying with us our iPad-based cognitive test game, which we may not have the time to share today, but would like to make you aware of, where we try to tap into these tests. And some of them are pretty similar to what you've seen in the past if you've had experience with any of our large studies. And here what you're asked to do is you have a part A that's asking you to connect dots in an ascending sequence from 1 to 26 as rapidly and as accurately as you can. That's what we call a control condition, so that it controls for visuospatial ability, speed, your motor ability, your ability to count ascendingly. Once we've gotten you to do that, then we make it hard and we get mean and we say, now what I'd like you to do is I'd like you to connect the dots you see on this page in an alphanumeric sequence, which requires you to shift from a number to a letter to a number to a letter and so on until you reach the end. Now this gets pretty hard, and this is an example of what we ask people to do. So they connect the dots and they keep going, and then right about here it starts to get hard. Does anybody know why? So what happens here is we're testing your executive abilities to flexibly shift between constructs and to remember them at the same time too. It's a lot of work. And so when you see people become a little more impaired, they're getting impaired as you get into the down here into the 5J, E, F, and so on and so forth. How do we measure that difficulty? Why do we care? Well, this is one of the tests adapted in World War II in 1944 or 43. And the goal here was to understand how people flexibly shift and order information. And for some reason, we've carried that forward, and any major study that you encounter will likely have a trail making test part B. So that's a test where, I want to come back to this when I talk about computerized testing. what we collect is we collect the time it takes them to start when they put their pencil down to the end of the test. And we just tally that number in seconds and minutes. It usually takes people more than a minute and a half to get through. And older adults, it can take up to 4 minutes. So this is a test where we spend a lot of time, and it's very complicated, but we don't get much information except the time to complete. And there are many people who they can't complete it. And in that context, we lose information because it became too hard for some segment of the aging population. We just lopped off the lower end of that spectrum of ability because for some people, it's just too frustrating. So that's why I'm going to be kind of coming around to this idea of cognitive testing by using computer-based models that will do the same thing, but they'll give us information from one connection to the next. So instead of having to get the whole thing, what we're doing now is we're collecting information that tells us how long did it take them to get from 1 to A? How long did it take them to get from A to 2, 2 to C, and 3, and so on? And that tells us how long it's taking, if it's getting longer, and we don't lose information that we might be able to use about their executive function. Similarly, we have a test that, again, many of you have heard about. It's actually predates. It's a 1935 test, one of the most widely cited tests, because everybody who's literate exhibits a stroop effect. And the stroop effect is whereby you see, we're all bred and learned through decades to read, not to name colors in our environment. And here, this is a paper-based version, and what is usually administered is a card. And the card's preceded by a card that allows you to name the color of ink without having to, it's pretty straightforward. And so this card is asking you to just go down the columns and read as quickly as you can. You're going to see that the goal here is to name the color of the ink and not to read the word, just to ignore the word and read the color of the ink as quickly as you can and go down. So this is how it's administered traditionally. What we've done for, I guess, over a decade now, maybe 12, 13 years, is we've said, well, you know what, let's get trial to trial measurement rather than conflating all of these trials and hoping that people, that broad number, whatever that is, sometimes you measure how many are completed in 2 minutes, depending on how this test is administered. It's a fairly imprecise measure of one's ability to, in this case, inhibit our propensity to name to read the name red and instead say yellow in response to our job, which is to name the color of ink. So
can I jump in for a minute, Michelle?
Oh yeah.
Yeah, so Erica brought up an interesting point on the chat that I wanted to expand upon. I think she was talking about trail making, but you can answer this for Stroop as well. Are errors incorporated into the score as well?
Yes.
And I just want to highlight, a lot of times, especially as epidemiologists, I love our field, but really we're interested in using a score for a model oftentimes. What psychologists are really interested in, and what Michelle's going to talk about here, however, is not so much getting a final score, it's really understanding processes. And there's a lot of work, especially in error analyses. I'm familiar with Edith Kaplan's Boston process approach, which is all about understanding how somebody came to produce a score, whether you're doing a trail making test or whether you're asked to draw a clock face, like 4:55 on a clock or something like that. The types of mistakes you make can tell you how a person is thinking or dysfunctions in their thought. And so we're just beginning, I think Michelle's going to get to this, we're just beginning to be able to evaluate the Boston process approach in large sample sizes by leveraging computerized testing.
Yeah, well said, Alden. Well said. And great question. That errors are incorporated into the time because we don't stop the clock. Yeah. So it's tough. If you've ever, I'm sure there are people here who have administered in addition to Alden and myself, and it's tough when people are having a hard time with it. It can get really tough. So, it's a test again that has its limits and its strengths. Let's see. So real quickly with this, what I thought I'd do is just show you kind of the difference between administering on a paper-based test to kind of, again, where we've gone, and this is a field, this has been done by many of us, is to take that kind of a test. And because of what we, like Alden said, we want to get to process and understand what's happening. We want to do it with greater precision and honestly comfort. The paper-based version, I tried to implement that in what was called the Women's Health and Aging Study 2 when I was a postdoc. And the coordinator at the time, Laura Fishpaw, she said, this is hell. She said, people hate doing this, that they hate it because it's just constant and it's a long page and it gets really hard. It doesn't get easier as you go along. And so she said, after piloting it, she said, no, people just weren't going to tolerate it. So something one has to learn when one's doing these kinds of assessments is learning what you think you can gain without burdening people, making them feel bad about themselves or feeling really tired and exhausted by doing it. It's definitely a dance of sorts. So what we did with the stroop is we brought it back and we did this time trial to trial learning and looked at, instead of looking at second accuracy, we looked at millisecond accuracy. And so here we'll give you the same test. I'm going to ask you to name the color of the ink as quickly as you can. And if you say the word, hopefully people here are saying the same answer. Does anybody want to say it out loud or do you want to put it in the chat? So let's try the next one. So that should be pretty easy as well. And we'll go on to the next one. And that one is also easy. And the reason is because your job is to name the color of the ink, but the color of the ink is reinforced by the word it's written in. Then we go along and we come to this. And this kind of shakes us a little bit because we want to say red or green. I'm sorry, what they want to say green. I've done this too much. You want to say green, but instead of saying green, you're supposed to be saying red. Time it takes you to say red in this context versus this context, there's a cost. And that cost is called the stroop effect, and we can measure that. And that's a cost to your brain and your cognitive abilities to process and push away the response you want in favor of the response that's less practiced. And we can measure that. And when we use these kinds of trial-to-trial based tests, we can do it a lot faster with a lot fewer trials in a shorter period of time. So that's kind of where our future is going. All right, should I pass the screen back to you then, Alden?
Yeah, sure. It's like softball.
Yeah.
So yeah, I wanted to bring in this one slide on perspectives of cognitive aging to really help crystallize, because these different perspectives that Michelle and I have been talking about. So, you know, I would say, Michelle, what I often, when I think of you, I kind of imagine you in the neuropsychological bubble here. So you're thinking about detailed cognitive tests and mapping performance onto brain regions so that we understand the brain, so that we understand functioning better. There's an epidemiologic tradition that is characterized by general, broad, brief tests, but large sample sizes. Think, you know, something like ERIC or CHS. And the questions tend to revolve traditionally around things like patterns and prevalence and incidence of this or that using those tests. We have cognitive neuroscientists who are really interested in fMRI studies and brain activation. To them, you know, cognitive testing is like an old generation, and you know, we're better than that. There's an experimental cognitive perspective, which when I think of this, I often imagine George Reebok in this bubble. You know, experimental cognitive psychologists are interested in detailed tests and particular theoretical processes underlying thought. This is where Kevin McGew comes from with his periodic table of cognitive elements. And then we have a psychometric perspective, which is really interested in measurement and factor analysis. As you can imagine, there's a really strong link, especially between all of these perspectives, but especially between psychometricians and epidemiologists. This is why, for example, Richie Sherritt still tolerates an Alden Gross. So it's great. We have lots of fun. So we wanted to shift gears now And let me make sure I still have an eye on the chat. We wanted to shift gears now and talk about time, because time is especially important in cognitive aging. Very much because how you perform on a test depends on your prior, not only your prior exposure to a test, but also your prior lived experiences. And so cognitive change, not necessarily level, not necessarily the level of cognitive functioning at one time point, is a fundamental feature of many cognitive disorders in aging. And the key challenge is that baseline cognitive level is confounded by premorbid conditions like risk factors like education, school quality, occupational complexity, and a bunch of other early life and midlife things. And so there's this, I believe this is Pito wrote a paper in the Lancet. I should have put the citation here, called and it was a brief letter on the horse racing effect. And I'll let you guys read that later. But it's this notion that if oftentimes if you see a large difference at one time point between groups on, say, a cognitive variable or even a heart rate variable, as I think the example here is, that difference doesn't mean that there's a pathological, substantive pathological difference in decline. It could be that these people started at very different set points early on. When we think about change and cognitive change in a study, we may be really interested in the effect of an exposure, such as, pick your favorite exposure, aluminum oxide exposure, or maybe there's some training, either a pharmacological or a non-pharmacological training that we think can modify cognitive rates of cognitive change. There's also just normal aging. And it's not, I wouldn't classify this as pathological aging. That's how I think about normal aging, although people don't like the term normal. There are contextual factors such as day-to-day effects. When was the last time you had caffeine? Were you tested in the morning or the evening? Do you have a cold from your 2-year-old who just gave you RSV last week? How are things going? Selective attrition in population-based samples. There are various statistical artifacts that we can talk about ad nauseum, like regression to the mean. And then there's retest or practice effects, which are, I was talking to Jen Trek a while ago, and she tells me that she sees practice effects in gait speed measures, which is really cool because I had always thought that this was unique to cognitive aging. But retest and practice effects is not only due to, episodic memory for the content of a test, but it also has a lot to do with reduced test anxiety that comes with experience of taking tests. Everybody in this room is or has obtained an advanced degree. You guys have had the testing. You guys have had the wazoo tested out of you, or however which way that phrase goes. You're in your 20s and 30s, and you're still in school. You're used to testing. A lot of our older adults who are 60 and 70 and 80 years old, particularly older generations, maybe they finished high school and maybe some college, but then they got back on the farm, or they got back to doing their own job that they enjoyed doing, and they're not so used to cognitive testing. So there's some anxiety. We can call it the white coat phenomenon, or whatever, what have you. There's also, I mentioned earlier, procedural memory for test administration. So just the act of sitting down with a pen and a paper and taking a test at a table, that can sort of jog your memory. All of these different phenomena may manifest as improved or even depressed cognitive test performance, even if there was no meaningful change. So going back to our roots, as Michelle mentioned, a lot of these cognitive tests were developed for World War I placement. There's a really cool old paper by Thorndike, and the year is cut off, but this is a Thorndike 1922 paper. And basically the problem that they were having was that, it was in World War II, people took the Army Alpha and the Army Beta tests, and they realized that some people, when they were tested a second time, they did better on the Army Alpha. And so, Thorndike's conclusion after writing this really cool paper was basically, hey, explain the test materials to these guys. Just make sure they know how to do it, and then give them the test, because we want these tests to be assessing people's maximal ability. We don't want your test score to be confounded with the fact that you didn't understand the direction. So explain the test, take some time out and make sure folks understand it. So as an example, in the trail making test, there's a part A, there's a part B, but before that part A and before that part B, there's a demonstration and a quick, just making sure people know that they need to touch their pencil to the page and physically draw from 1 to A to 2 to B and so on and so forth. Excuse me. So explain the test. The challenge is, over time and over the decades and across generations, we've kind of either forgotten that, or we've kind of let that lesson go because of time constraints. We need to test people, and we'd like to get them back home before dinner. So, I have a whole manifesto on practice effects, and I realize we're coming up near the end of our time, but I have a whole other lecture that I'm happy to give sometime. Practice or retest effects in cognitive testing, this is the reason people take the SAT twice, because you do better the second time. And it's important that we acknowledge there are practice effects in many to most of the studies that we have longitudinally measured cognition on. So, you want, and it looks like this at bottom. So time is on the x-axis here, and the y-axis is your cognitive score of some sort. And basically the practice effect means there's a bump from the first to the second testing occasion. Some people think that practice can also be apparent from the to the second to the third, and the third to the fourth, and so forth. That's an academic exercise that we can do. But I would argue that it's impossible to know the true pace of cognitive decline. If that's your question, how are people doing? How are people changing in your cohort? It's impossible to know that question without making an assumption about the practice effect. And more often than not, many researchers and many studies assume there is no practice effect. That's a big assumption that that you're making. You can oftentimes sort of diagnose this by looking at doing straightforward evaluations of fit to your data. Like, is this line here fitting your data really well? Or do you have a lot of residuals at that second time point? You can model practice effects really well in a variety of ways. And the way that we model practice effects doesn't really affect estimates of exposures on cognitive change. So that's a good news. A common thing that's done in cognitive aging, especially for memory tests, is that people try to use alternate forms. I was just reviewing a paper last night where investigators were modeling longitudinal change on the auditory verbal list learning test using data from ADNI, the Alzheimer's Disease Neuroimaging Initiative. And that is a classic example of you shouldn't do that. There are papers that are now 10 years old explaining why you shouldn't model within-person change using the AVLT in ADNI data, which is like one of the more popular data sets in all of aging. The problem is investigators used alternate forms. So instead of ball, flag, tree, hat, they decided that they were going to use book, cabbage, grass, leaf, or something like that in alternate forms. So when you're looking for alternate forms, you've got to make sure you balance the lexical frequency of the word, the number of syllables of the words in your word list, and a whole bunch of things. Essentially, word lists are almost never parallel. And so not only are you failing to correct for a retest, it adds unnecessarily complex information to your analysis of trajectories. Practice is due to more than just memory for test content. It also depends on the context in which you were tested. And I'm going to stop there. Michelle, did you want to talk about EMA?
Yeah. So I'll kind of, there's so much, I think that you touched upon that we could elaborate on later or ask, if there are questions that are specific. It's really important to the point that Alden made, you pick a test and you address these issues. Oops, the prior screen is good. Is just you pick these tests based on the question you want to ask. Practice effects can really swamp your measurement signal when you're doing trials. And so you really work hard to understand what is that outcome that you think you're going to move in your intervention, for example. And then you try really hard to go back and try to mitigate practice effects. And what Alden said is right on point. We still don't know how long a practice effect can last, but when you use epidemiologic studies, you find they're very robust to time. So these are really important points to kind of unpack later. And our hope is that you'll bring these questions back when we talk about measures throughout the EVA series. This is really just meant to kind of give you some touch points that you could always, interrogate later. So if you don't mind, on that slide that I had there, I wanted to mention, I want to go back to time. I think following on Karen's talk 2 weeks ago, Alden and I really took up the mantle to think about how important time is to our measurement of cognition. So on the one hand, practice effects are really important. We've talked a little bit about time in terms of even just the way you administer a test. I'm going to talk about time in terms of test retest assessment as well here, and talk to you a little bit about a movement that really comes to be possible through our wearable devices. Our iPhones and our droids give us much information. They're giving lots of companies a lot of information. Whenever you use an app, you usually accept their terms, and their terms usually involve data collection on the passive end that involve GPS, geoposition coding system, where they're looking at where you're going. They're looking at your walking behavior. They're looking at a number of behaviors, and their goal is to sell you more or to get you to use their service more often and things of that nature. On our end, our goal is to go from 20th century tools of pencil and paper to 21st century tools and not dump, throw the baby out with the bathwater. Use the tools that we've been given. They've been very successful, but improve upon them. And that gets to this idea of real-time assessments where you can measure cognition, whatever domain you're interested in, that gets to what you're interested in addressing in cognition. It might be memory, it might be executive function, it might be function, how you're doing in day-to-day life. And to do that, what we are really moving more and more towards is this kind of just-in-time technology where you can actually, rather than have somebody come into a lab and do these tests, sit them down, then move them from that fairly static setting to their daily lives. There is a day here where we can actually measure cognition in real time with brief tests that, like the Stroop test I showed you a few moments ago, where we can assess their mood and their memory and their cognition in bursts of maybe a minute or two, and then look at that over repeated assessments over a particular window of time. And we can reduce the variability because we're getting multiple assessments that control for variability in time of day, variability in whether you're caffeinated or not, variability in whether you're tired or not, things of that nature. And so that's kind of where I'd like us to, and that's something my lab is working on pretty actively as well. So I think that's our future. And I think epidemiology can embrace this very readily. Good. Alden, I'll pass back. I don't know what we've got left. Oh, I'll hold on that. I'll hold. You can.
Okay.
Go.
Yeah, I think that's all we had. And Oh, shucks. We were all planning for there to be like, 20 minutes of questions, but as often happens when you have a fireside chat with people with PhDs, we just talked the whole time. Sorry about that.
Well, you guys, thank you for just an incredible wealth of information. Let's go ahead and thank Alden and Michelle for, just a fascinating talk. We really appreciate it. As usual, let's let people go who need to. And unfortunately, this particular week, I am one of those people. But I would invite others to please, stay behind and engage in another, 5 minutes or so of questions. So again, thank you both so very much. And I'll turn it over to the two of you to moderate the rest. Take care, everybody.
Thank you.
I don't know who's hanging out for questions. Can I start or just make it some more of a comment? But
well, Jen, can you answer the question? How should we measure cognition? I was wondering.
No, I can't answer that question.
Okay, good checking.
Thanks for asking. I was gonna talk about the same thing though. I mean, I was just gonna put the plug in for sensory, right? In terms of traditionally the way we measure on paper or by verbally reading. And so that can make it difficult for people who are hearing and vision loss. And we're lucky. So Bonnie and I have been able to work with both of you in terms of thinking about that. But just to highlight to the trainees and anyone who's here, it does make a difference. So maybe not so much in the measurement, but certainly in the self-selection for completion, it makes a difference in terms of the testing. And it made me think, Michelle, when you were talking about the stroop test originally and how it was too burdensome. And, I think that's just part of it. The cognitive load is too strong there. And so people choose not to complete the testing. And I do know you have some exciting ideas in terms of the measurement online and in that space that I think could potentially help us in that area too. So thank you for mentioning. I also think that's exciting in terms of a new direction.
Thanks, Jennifer. Whenever you're ready, we've got we have the app ready. We've been using it. It's so much more fun too than the paper stuff. But thank you. Your work, I hope the work on sensory function has been an understudied topic, something we actually should add because we really don't do a good job of sort of assessing, first of all, when people hear words, do they hear the same words you're saying? And there could be very many opportunities where people are cognitively functioning well. It's just their sensory functions did not allow them to hear or see it. And we really need to understand that better. So Jennifer and Bonnie are really leading the way in that regard across a number of studies.
Thank you.
And just to draw a connection back, this goes back to Thorndike's paper on from 1922 that I highlighted. Like when we give a test, we assume that you're operating at your maximal capacity. We assume that you're not limited in some way by either not knowing the test material or not knowing how to read or not being familiar with numbers or having eye or hearing sensory problems. So, if we really want to understand what's going on in the brain, we have to assume that people have the capacity to do what we're asking. We also have to assume that people are motivated to actually do well on our task, or if they're just gonna phone it in. Because if they get mad and they get frustrated, they're just gonna ignore the test and just say, "Oh, those 15 words that you read 20 minutes ago, I don't remember."
That's an important point too. And also for thinking about the ordering of the tests, which is, so incredibly well thought out before any study, kind of goes, but that's part of it too. Like, we saw in Eric with hearing, people were not finishing tests at the end of the battery that didn't involve hearing, but they were just hard tests. And they were at the end of the battery and they were already too tired. So yeah, that ordering of the test makes such a difference.
If we have just another minute, I wanted to ask, I was excited to have the conversation about time and how time impacts cognition. And I was wondering if you could speak to how we have changed in our use of information and manipulating information and how these cohort effects, if you've seen them in some of the the data that people have been analyzing, that maybe younger generations are performing differently on tests because we're just using information in a different way. And or if that's just a newer field that we don't know a whole lot about yet.
Well, there are people who know a lot about that. I don't know so much. Yeah, like younger people, not so much younger people. Hey, I'm middle-aged. I'm much better on my phone, and I may not know, factual facts about what something is, but I know where to find it. And so that type of thinking is shaping generations.
Yeah, and on the MMSC, isn't one of the questions about like what day and date is it? And I feel like since I use my phone all the time to remind me of that, that's not something I bank in my memory all that often. So people may be performing worse on these tests over time because we're using information differently.
Exactly. And that goes back to, your working memory and then long-term memory. Today alone, I have probably dated 24 files and signed a couple things with today's date without looking over at the corner of my computer screen that tells me what the date is. I was like, what's the day of the month? I think it's the 24th. Yeah, I'm pretty sure it's the 24th. And yeah, I would totally get that wrong right now, because that's only being stored in my short-term memory. I have no reason to know that today is the 27th because tomorrow's going to be the 28th. I'm not going to waste my time memorizing what day it is right now.
Alden, I did the same thing. I tried to convince my oldest yesterday it was the 23rd. So we're on the same page in terms of the date.
Yeah. Or maybe we're just impaired.
Yeah, well, we're all there. That it's great to hear you guys say that. So, but what I want to say, and what you said, inherent to that is a judgment value as well as to what people value. And so we probably have to unpack that, what people are good at versus what they value. And so these days, for example, memorizing a phone number doesn't happen anymore. You'll just call them, right? You never like write it down, you never memorize it. So you just say, because you have that tool, and so you don't value the need for it. And then the question I think Erica's asking is, does that change you? Does that process of not needing to exercise that and valuing that skill set, does it actually change? Do you later, maybe in the same generation or successively, maybe it takes a generation or two. I don't know that we know that yet. I don't think we do. I've participated in some Rockefeller Institute's been really interested in this question about young brains and if we're training them to be inattentive. And so I think that there's some great work being done. I'm like Alden, I'm not aware yet of what we know, but I know it's a great concern that we are teaching people to have short attention spans. And so I'm looking forward to seeing whether that data actually applies or whether someone can be attentive when they're valuing it. When they're given an opportunity and a motivation, will they have better attention? And I think that's where we are right now.
Yeah, but this is a really important question because it affects how we learn, how we teach, how do we teach our children? There's constant debates over, should people learn with books and sitting at a desk and listening in a linear communication style in school, or are we better learning in lab or small group types of environments or applied settings? These are sort of in many ways age-old questions. I'm reminded of the Socratic method is called the Socratic method for a reason. But yeah, how do we learn?
Great question.
How do we? Yeah, but that's a good point, Michelle. What are we good at versus what do we value?
We're going to find out, I think. Yeah, great question, Erica. Do you have any speculation? I wonder, if you don't mind, but because you asked that nuanced question, do you have any hypotheses or data?
Well, now that you've kind of brought up this judgment and value piece of it, as the assessor, we are also putting value and judgment on specific kinds of knowledge. And so people may be performing poorly because whomever who's I actually I should not talk about this because I'm not in psychometrics, but there has to be some kind of value in specific types of memory and knowledge that people are putting into these tests, that people that you're assessing may be performing poorly because they don't value the same types of information you're asking or inquiring about.
This,
yeah, go ahead.
No, I was going to say this comes up in cross-national and cross-cultural research. So a common test is a story recall test. So I'm going to read you a story about Anna Thompson of South Boston, went to the market and did all this stuff. And I want you now to remember as many of the story elements as you can from that test. And there's 25 story elements, and you're graded on how many of those details that you can remember, right? When they field that kind of a test in India, and in India, I have to preface, and this is also true in other places, but India, there's a strong vocal and storytelling tradition. In India, anecdotally, I heard that when a lot of the administrators administered their the paragraph recall task, these older adults responded like, "What you want?" They were asked, "Okay, can you tell me about that story?" And they were like, "That's not a story. That's a terrible story. Here, let me tell you a really good story." So then they would make up a story like on their own. And that's, but that's what they value, is the ability to tell a good story, because they have, again, strong oral traditions. And we in the US and Europe, somewhere along the line, we started writing everything down, and I guess we don't have that any, as much as strongly anymore. Yeah.
Thanks to you all for holding out with us for longer, clearly past the 4:30. We really appreciate the interest, and then these slides are obviously shared or recorded for sharing if you come back to some of them and want to think about how it applies to one of your proposals or questions in an existing study or one you want to start. You know where to find us. But it was great to talk to you both. It was fun to do this with Alden. I really, really enjoyed that part as well. So
yeah, this is awesome. Yeah, thanks
both
for inviting us.
Thank y'all for doing this. I still don't know which of these would be the best measure to use for what I'm doing, but I promise you I'll be in contact. Don't you worry.
Spend more than 10 minutes on it.
Yeah. Okay, got it. All right, y'all have a good one.
Cool. Have a good one.
Bye, thank you.